Hello. I'm going to present a case today that was really very interesting. She had already had previous surgery done for her neuroma, which was apparently removed on her left foot. Afterwards, for 8 months, she continued to have pain. In fact, the pain got worse. She complained of symptoms like burning, sharp shooting pain. She had like a frostbite sensation on the bottom of her foot, and she felt when she was walking like she was walking on rocks. So she kept telling her previous surgeon that it was getting worse, and he said it would just take more time. But after 8 months, she was referred to me by some vascular surgeon, vein doctors, Dr. Johnson, Dr. Rao, here in Houston. And I'm very happy to say that we were able to help her. I've developed a new approach for Tarsal Tunnel. Normally it's done through a large incision, and we've been performing for 20 years now the Johns Hopkins technique in releasing the nerves in the tarsal tunnel through long incisions. Over the past few years, I have gradually moved from one small incision, occasionally two, and in this case, 3 small incisions with 3 stitches to solve her problem. She also had a lot of forefoot pressure from what we call an equinus, which is, if you think about horses that walk on their hoofs and their toes, that's where the name equine comes from. And so with this equine, she got excessive pressure on the forefoot, which was actually delivering the pain into the neuromas that the original surgeon was treating. But what was missed here is that she had back at the ankle compressed nerves called tarsal tunnel. And in the tarsal tunnel, these nerves are burning, tingling, numbing because they have increased pressure. And this increased pressure is creating the pain. This is exactly like you would find in a carpal tunnel syndrome, where you have a nerve pinched here in this particular tunnel, which affects these 3 fingers. In the lower extremity of the foot, it's not just one simple tunnel. However, we have 3, sometimes 4 and 5 nerves that get entrapped in the bottom down here. So we were able to release all of these nerves there, and then also lengthen her calf muscle to take away the equinus, or the pressure on the forefoot, and you're going to hear her story now.
One day we went into the office and we kept pushing right here. My husband, he said, why does she have all those indentions and why is her skin like that? And he said that those were veins, and he don't have nothing to do with veins, that I'd have to see a vein doctor. So I went to Dr. Johnson and Dr. Rao, and they talked to me before I had it, and I told them too, I was scared, because I just had surgery and I was already in a lot of pain. And he said it would work. So I think it did work, because I used to have a lot of heaviness in my legs, like I couldn't stand for a long time, and then he did the pain treatments. And then when I went back for the follow-up to him, he told me, how do you feel with your legs? I said, my legs are good, but my feet are awful. And he says, I think you should go see Dr. Parker. And I said, okay. He goes, you should get a second opinion.
Wonderful. Well, I'm so glad
he's the one that sent me to you.
Good.
I told my husband, well, let's go for a second opinion.
Yes. Well, I'm so glad that we were able to help you, and so I love to see the smile on your face.
I know. I can smile.
Oh, this is your anniversary.
Yes,
congratulations again.
Okay.
All right, you're a lovely patient. Be patient now, because you'll go through ups and downs as these are healing. You might have some burning, tingling, and then it'll go away, come, and go away, come. But after 6 months or so, things should just be kind of going good, or before, hopefully. It looks like you're doing great now. So thank you, Susan. I appreciate it.
It feels a lot different. It's a whole different feeling. That's what I told my husband. I could feel it. I couldn't feel my toes or anything before, and even through all the bandage, I could feel it, and I was moving it, and I was like, oh, and one more thing, at night I don't get that frostbite sensation.
Oh, that's gone too.
That's gone. My feet are a little cold now, but because I'm in here, but it's a cold that I can handle.
Was that frostbite sensation in the big toe mostly, or was it all the toes out here?
My whole foot.
The whole foot, you had a frostbite.
I felt like it was the whole
So
foot.
when you would like in the evenings before you went to bed, or when you went to bed? When did you feel?
Especially when I would get in the bed.
Then you'd feel that.
So that was bad because I wanted to lay down because that's the most comfortable part, right? But then I had that. I mean, I even got a heating blanket and
To put on there. Is this foot doing the same thing? Is it getting that frostbite sensation at all? No. Good. Okay,
And I
just
don't
this
know
one.
why. That's what I told him. I said, I don't know how that one went away just because this one went away.
Wait, so this one feels better since the surgery, you mean, or you just
I mean,
never?
I still feel the numbness in the feet and everything. I'm not real sure about this one yet.
Yes. Well, let's see 6 months out and see how things are doing.
Yeah, I don't feel the frostbite, and that's a whole nice thing.
Good.
Because I buy warmers and I buy those socks that heat your feet and
Awesome.
everything.
Well, you missed the big old incision that goes down from here all the way up to here. And today I'm doing all of this through these 3-stitch incisions.
Mm-hmm.
I call it the trifecta.
Yeah, it looks like one.
Okay, good.
Okay.
You've done really well. As you can see, this patient got a marvelous results with this minimally invasive surgical procedure. These small incisions, which takes the place of an incision that is literally about this long, gives this patient shorter recovery time, less pain, less time in the OR. It's a win-win all the way around. I'm happy that she had these results. Also, you'll notice that the pressure on the forefoot was taken away by the Ballman procedure for the equinus that we talked about previously. And she's a very happy patient. The burning, tingling, the shooting pain, the frostbite sensation, the rock sensation when she walked on the bottom of her foot, and the numbness and the lack of motion in her toes have all been addressed through this minimally invasive surgical decompression of the tarsal tunnel. I hope you enjoyed this, and if you're having similar painful tarsal tunnel symptoms in your feet, you can find us at parkerpodiatry.com, Parker Foot and Ankle, or Neuropathy Care Center of Houston. I'm Dr. Robert Parker. Thank you.